I'm Dr. Dana, and I've been informed that your baby is currently in good health and will be able to go home very soon. Congratulations on this good news. You have been doing an excellent job so far. However, babies that have required an ICU admission will require more care and attention even after discharge. There is a small risk that the baby may stop breathing. In such situations, immediate treatment is life-saving. In an out-of-hospital emergency, you are the best possible person that can save your baby's life. So today, I will ensure that you are equipped with the skills that you need to save your baby's life in case such an event occurs. Now, I understand that these skills may seem hard at first, but after watching this video, you will feel more confident in saving your baby's life if you ever need to.
When a baby stops breathing, you must provide breaths using this device. Let me tell you more about this device and how to use it. This is an ambu bag which helps to deliver breaths to the baby. The end of the ambu bag is attached to the mask. This is how you fit the mask onto the ambu bag. This part is applied to the baby's face to provide breaths. When you squeeze the bag, it will push air into the baby's lungs. Feel the air on your palm when you squeeze, and when you squeeze more, you can hear this hissing sound. This shows that the bag is working well. Sometimes secretions may block your baby's airway. This is a daily suction that can be used to suction away any secretions. Put the plain end in your baby's mouth or nose. Put the other end between your lips and suction away secretions. Don't worry about secretions entering your mouth. Using this device, all secretions will get trapped in this chamber like this.
But how will you know if your baby requires resuscitation? And what should you do?
If you find your baby not breathing, first check if there are chest movements. If there are none, call another person for help and dial 108 for ambulance services. Position your baby on a firm, flat surface. Be at the baby's head end. Gently tilt the baby's head so that the airway is open. Suction the baby's mouth first and then the nose to clear any secretions. Rub the baby's back. Many babies start breathing with this stimulation. If the baby is still not breathing, proceed to the next step of providing breaths. Apply the bag and mask like this, covering the chin, the mouth and the nose. Deliver breaths by squeezing the bag. Say breathe 2, 3, breathe 2, 3, breathe 2, 3. Squeeze the bag while saying breathe and relax the bag while saying 2 and 3. Be sure to keep a tight seal with the mask the whole time. While giving breaths, make sure you observe the baby's chest rising and falling each time like this. This is the most important step in saving the baby. If you don't see the chest rising and falling well, reapply the mask and ensure a tight seal. Suction again if needed. Once you see the chest rising and falling, continue delivering breaths for 30 seconds. That's approximately 20 to 30 cycles of breathe 2, 3, breathe 2, 3, of breathe 2, 3. After 30 seconds, check if the baby is now breathing or crying. If the baby is still not breathing, continue the same, checking every 30 seconds for spontaneous breathing or crying until help arrives or till the baby starts breathing well. If the baby starts breathing, then stop the resuscitation. Continue to stimulate till the baby starts crying well. Remember,
If you find your baby unresponsive, call for help, place on a firm surface, suction and stimulate, deliver breaths. Look for chest rise. Once chest rise is present, continue for 30 seconds. If not, perform corrective steps. Check for breathing or crying and continue till help arrives.
Please note that it is most important to provide breaths to your baby. Do not stop the resuscitation if you find it ineffective. Correct yourself and continue till help arrives. Chest compressions are not that important in newborns. Now, after watching the video, you might be feeling anxious that such an emergency might happen. However, let me reassure you that the chances of this happening are very small. But in case it does happen, these are skills that you must have. And just like any skill, delivering effective breaths during resuscitation requires both practice and revision. So feel free to replay this video as many times as you like. By practicing and re-watching the video, it will become much easier. We will also be arranging for a hands-on session prior to your discharge. Thank you.